ADHD, and what are medications for ADHD doing? And is there a natural Ritalin? What we do understand so far is how Ritalin works and how any stimulants work. And in essence, they affect the chemicals and the neurotransmitters within the synapses of the brain. Ritalin has been shown to influence and works on the basis that what it's doing is it is changing the reuptake of certain neurotransmitters like dopamine and norepinephrine or noradrenaline within the system. And so changing the response that is the other side of the synaptic cleft. Now, the behaviors that manifest as a result of this nerve transmission will be the presentations that might be zoning out, hyperactivity, attention, these kind of human presentations. But what are the neurotransmitters and why are they there? Why do they change? What causes the production and the stimulus of these things? We tend to think in a very organic approach rather than a functional approach to the neurochemistry of the brain, that there is some kind of dysfunction, this happens in these people, it's not their fault, it's unavoidable, and so, this is that, therefore it's just, well, they have this thing, and therefore we need to medicate them for it. But what if you could do it differently? In the same way as, well, we'll give you an anti-inflammatory. Well, what if you went, why is the tissue inflamed? Well, okay, you're right. Well, I was hit by a car. Well, okay, you probably can't undo that. And so you might need to help the tissue heal and inflame. But if you've got a chronic inflammation, why is it there? Is the answer is to give you steroids for the rest of your life to suppress the swelling that's going on around your heart? Well, it will keep you going, or your gut, or anywhere else that's becoming chronically inflamed. Or do we understand what in the system, what in the nervous system is causing the inflammatory cytokines to be released into the system? Well, then you can start to actually create natural healing. And so if we understand through the same vein how the neurochemicals are being released in the brain, then surely we can do something to have a natural resolution to the symptomology we call ADHD. If we look at dopamine and norepinephrine, and it's low levels of that which tend to create the presentation of ADHD. Well, dopamine and norepinephrine or noradrenaline are basically neurochemicals that will be released by the parasympathetic nervous system. So the parasympathetic nervous system is the calming side of the nervous system as opposed to the sympathetic, which is activation. Activation will create high activity. So could it be that a lack of balance in the nervous system or trauma that has caused a dysregulation and people fluctuating and vacillating very fast between sympathetic and parasympathetic, or even doing both, having your foot on the accelerator and your foot on the gas at the same time instead of being in this regulated space? What's that going to do to the production of neurochemicals? Well, if you don't have appropriate level of parasympathetic and you don't have the ability to settle your system, possibly because of events in our early years, perhaps our childhood, perhaps stressful life events like the pandemic, which were unavoidable, but that's shaped a developing nervous system. What if that has meant that we're unable to produce quite the same neurotransmitter chemical within the brain? Might that mean that this synaptic behavior is changed in the way that we observe that Ritalin shifts? Well, what if we could shift that neurochemistry through more natural mechanisms by helping people to retrain the nervous system to be able to create precisely the same changes within the neuronal synapse that you get with Ritalin and other stimulants. And I think that's a very exciting possibility. Is there strong evidence for that yet? it's not there. It's not there yet, but neither is there any other evidence really to suggest an absolute understanding of ADHD. We have some evidence that gives us some clues about what's going on, but exactly why, we're not sure. My personal experience clinically is that I have helped several patients fundamentally remove all of the symptomology that they would fall under the category of ADHD. And so I want to challenge the notion that the only way that we can address ADHD is through chemical stimulants. I'm not criticising anybody if that's the path you choose. This isn't about having a go at anybody at all. Quite the opposite. This is just a compassionate view for saying some people might really feel that they want to see if there's anything that they can do to improve the challenge that they face in their life. And if that's you, then certainly we can help. Hi, I'm Roger. Thanks for watching the video. Hope you enjoyed it. And don't forget to hit the like and subscribe buttons.